At the age of 21, college student and All-American athlete Brett Weiner is losing his battle with major depression. One night, his condition grows so intense that he begins hearing voices telling him to commit suicide. He's taken to a nearby hospital, and the following morning, his nurse arranges to have him transferred to a psychiatric facility. Upon the arrival of the EMS crew, the nurse explains that although Brett has been perfectly compliant for her, the ER physician nevertheless considers Brett to be a flight risk. And so, after introducing themselves to Brett, the EMTs load him into the ambulance, where the attending EMT anchors Brett's wrists to the stretcher using a pair of soft restraints. He then sits down on the bench seat beside his patient, and the ambulance departs on what is, so far, a classic example of an unremarkable, run-of-the-mill routine transfer, indistinguishable from thousands of others exactly like it. But the ordinary and mundane sometimes changes, as if to prove Murphy's Law that if something can go wrong, eventually it will. About 10 minutes into the journey, Brett asks the attending EMT sitting beside him, "Would you mind to move to the seat behind me? Having you sit right there beside me is making me feel very uncomfortable." Well, not wanting to cause his patient any anxiety, the EMT complies with the request and moves from the bench seat to the captain's chair just behind the patient's stretcher. A few minutes pass, and the EMT receives an unpleasant shock. Brett is now standing in the back of the ambulance, free of his restraints. Quickly, the attendant grabs Brett and struggles to keep him inside the ambulance. The driver hears the commotion, pulls the ambulance over to the shoulder of the highway, and radios for help. While Brett escapes, sprints across 7 lanes of traffic, and just keeps on running. Amazingly, there happens to be an off-duty police officer nearby, and he manages to catch up to Brett only a few moments after his escape. The two talk over things for a few minutes, and then the officer begins to escort Brett back toward the waiting ambulance. But just as they reach the roadway, Brett pulls away and steps into traffic, right into the path of an oncoming pickup truck. He's struck and dies there on the scene. 18 months later, a jury awards Brett's family a $1 million judgment and finds the attending EMT guilty of gross negligence. How do you think the jury reached their conclusion? Was it that the EMT had a responsibility to prevent Brett from escaping at all costs? I mean, did the EMT have a duty to tackle his patient in the back of the ambulance and pin him to the floor until help arrived? No. All you have to do is skim through any EMS textbook and count the number of times you find statements like, "The safety of the EMT is always the first priority." We are not trained to dogpile our patients, apply pain compliance techniques, or put aggressive people in arm bars and submission holds. That's not our job. Those sorts of things are best left to the professionals, our brothers and sisters in law enforcement. And for us to try and mimic what we've seen on an episode of Cops or in a UFC fight, that would be reckless, to say the least. Okay, so if that wasn't what led to the jury's conclusion, what about this? Was the real issue simply the fact that the patient died? That seems like a logical reason to throw the book at anyone, right? Wrong. Like his escape, Brett's death was the result. And while resulting damages are essential to any claim of gross negligence, The pivotal question for the jury in this case was whether the EMT was in some way responsible for those damages. Had he breached his professional duty to his patient? Had he deviated from the standard of care? And if so, were those actions a proximate causation of Brett's escape and ultimately his death? In the jury's opinion, the tragic events were set in motion when the EMT made two significant and preventable errors that arguably another EMT acting in accordance with the standard of care would not have made. First, the EMT allegedly applied the soft restraints incorrectly. Second, he moved from the bench seat, a position that afforded him an unobstructed view of Brett's restrained limbs, to the captain's chair, which, with Brett sitting in the semi-Fowler's position, impeded his view of the restraints. The jury believed that if not for the EMT's actions, Brett's death could have been prevented. There is no happy ending to this story. There were no winners. No one came out victorious. Everyone lost. And I cannot help but wonder, if Brett had been your patient or mine, could our story have ended just as tragically? Well, tell me this. Have you ever transported a depressed or suicidal patient? Have you ever placed a patient in soft restraints? The fact is that more than 95% of EMTs and paramedics have restrained at least one patient. 3 out of 4, 75%, have seen a patient escape from a restraint device. How about you? That number is far too high to be written off as merely a handful of providers in need of some remedial education. This problem does not belong with individual providers. The problem is systemic. It's a problem that threatens every EMS provider and every EMS agency in the United States and beyond. Friends, something is horribly wrong with our approach to patient restraint. But, unfortunately, escape is only part of that problem. If you had to take a guess, what would you say was the cause of Adam Lynch's death? What position was he in while he was being held down? He was prone, but for how long? No more than 4 minutes. And by the way, think about this. Was he ever actually placed in physical restraints? Was he ever hogtied? Was he ever sandwiched between two backboards? No. In fact, none of those things that we are commonly taught not to do with patient restraint, those things did not apply in this case. My point is that Adam didn't die after being restrained. He died while people were trying to restrain him. It was quite literally death by dogpile. And sadly, he's not the first victim of restraint-related death. Over the years, there have been many such deaths, often long before a single restraint could even be applied. And restraint-related death is an equal opportunity killer. It doesn't discriminate on the basis of gender, race, or even age. A well-known attorney who works often with EMS agencies once observed that a flurry of lawsuits has occurred in the area of the death of individuals who have been restrained. These in-custody death cases have mushroomed in recent years and are often coupled with civil rights claims. These will require services to closely scrutinize any restraint policies they may use. My friends, when we restrain someone for the purpose of controlling his behavior and providing treatment and transport that he doesn't want, there are a lot of legal implications that we need to be well acquainted with. You see, when you restrain someone, not only have you just deprived that patient of the freedoms guaranteed by the United States Constitution, you've also taken away his ability to protect himself. The second you place restraints on that patient, guess who's responsible for that patient's well-being? Yep, you. In much the same way that a parent is responsible for the safety of their children, you have assumed what the law terms a fiduciary responsibility to protect that patient from harm. That's why most of the restraint devices you find on the market today are manufactured with quick release features, just in case something happens where you need to quickly get the patient out of those restraints in the event of some sort of emergency. Say that you've got a patient that begins to vomit, and because they're in those restraints, they can't protect themselves against aspiration. That may especially be the case if you've also chemically restrained that patient. Or, God forbid, the cab catches fire, and you're unable to get the patient out of those restraints in time to prevent that patient from being burned alive. Whatever happens to them is on us. But despite how common it is for EMTs and paramedics to perform behavioral restraint, folks, the vast majority of us have received little or no training in the practice at all, nor any training in how to avoid all of the legal pitfalls, and those are very, very real, as you'll soon find out. But how can anyone expect you to know these things if no one has ever bothered to teach you? It's kind of like playing a game without knowing the rules. How do you prevent yourself from breaking a rule if you don't even know what the rules are? 90% of EMS providers in the United States and abroad say they received a grand total of between 0 and 4 hours of restraint education in EMT and paramedic school. 0 to 4 hours. For comparison's sake, consider that a newly recruited law enforcement officer completes as much as 200 hours of restraint training in the police academy alone. That's nearly 60% of the officer's entry-level training. Meanwhile, restraint comprises a meager 0.2% of initial EMS education. And it shows. Go to YouTube and run a search for EMT restraint training. What you'll find there is either going to make you laugh hysterically or it's going to send your blood pressure into outer space.